Systemic Lupus Erythematosus, the butterfly code, don't let it ghost us. 11 criteria we need for the play. Listen to the rhythm of the SL brain and beware. Serositis, chest pain when you breathe. Pleuritis, pericarditis underneath. Oral ulcers, painless in the mouth. Arthritis, moving north to south. Not erosive in 2 joints or more. Photosensitivity, skin feels sore in the sun's core. Check the skin, check the signs. Discoid or Malar crossing the lines. Are you ready for the hook? Let it burn. It's the lupus lesson you've got to learn. SLE Lupus criteria clear as can be. Skin and joint, blood and mind. The antibodies you're gonna find for the 11, that's the score. Sing it loud until you know it for sure. Blood disorders, anemia or low white. Thrombocytopenia, losing the fight. Renal failure, protein in the flow. NA positive, the screening we know. Immunologic, dsDNA, Smith or APL. Neurologic, Caesar, psychosis, tail. Malar, rash, the butterfly wings. Cheeks and bridge where the redness clings. Discoid, rash, patches running deep. Chronic scars that the skin will keep. 1 through 11, the diagnosis we read. SLE